It doesn't sting. It doesn't bite and pull away. It feeds slowly, painlessly, often on someone's face while they sleep, which is exactly how it earned its disarming nickname. But the real danger isn't the feeding itself. It's what this insect leaves behind afterward. Microscopic parasites in its own waste, deposited near the bite while a person sleeps undisturbed. And in some documented cases, those parasites have gone on to silently damage the human heart for decades before anyone realized anything was ever wrong. This is the kissing bug, more accurately called the Triatomine bug, found across the southern United States, including Texas, the Southwest, and parts of the Southeast, typically in rural or semi-rural areas, hiding in cracks in walls, under porches, in animal burrows, or inside structures with gaps that allow easy entry at night. It's nocturnal. Drawn to the carbon dioxide, humans exhale while sleeping, which is precisely why bites so often happen on the face, near the mouth or eyes, while a person has no idea anything has approached them at all. What makes the kissing bug genuinely dangerous has almost nothing to do with the bite itself, which is typically painless thanks to compounds in its saliva that numb the skin and prevent blood from clotting too quickly while it feeds. The real threat is biological hitchhiking. Kissing bugs can carry a microscopic parasite called Trypanosoma cruzi, a single-celled organism that causes a disease known as Chagas Disease, and the way this parasite gets into a human body is almost uniquely indirect among dangerous insects. The bug doesn't inject the parasite through its bite. Instead, after feeding, it often defecates near the bite site, and the parasite lives in that waste. If a person, often half asleep, scratches the itchy bite or rubs their eyes afterward, they can unknowingly transfer the parasite-containing waste into the bite wound itself, or into a mucous membrane like the eye or mouth, giving the parasite a direct route into the bloodstream. Once inside the body, Trypanosoma cruzi behaves unlike a typical toxin or venom. It's a living organism, capable of invading human cells directly, particularly cells in cardiac muscle and the digestive tract, where it can multiply and persist for years, sometimes decades, often without producing any symptoms severe enough to draw attention. This is why Chagas disease has earned a reputation among medical professionals as a silent disease, one that can cause significant internal damage long before a person ever connects their declining health to an insect encounter that may have happened when they were a child. Evolutionarily, none of this is a weapon built by the bug itself. The kissing bug isn't venomous, and the parasite isn't something it produces. It's closer to an accidental partnership, an insect whose blood-feeding habits and bathroom habits happen to create a transmission pathway for an opportunistic parasite that evolved to exploit exactly that kind of opening, using the bug purely as a vehicle to reach a mammalian bloodstream where it can actually live and reproduce. In most documented bites, the initial encounter feels almost nothing at all. The bug's numbing saliva keeps the area painless during feeding, which can last several minutes as it draws blood undisturbed, often from someone sound asleep with no awareness an insect is even present. The first noticeable sign frequently doesn't appear until the following morning, when a person wakes to find a mildly itchy, slightly swollen welt, easy to dismiss as a mosquito bite or a minor skin irritation, with no reason to suspect anything more significant occurred overnight. For most people, even those who do happen to be exposed to the parasite, nothing dramatic follows immediately. But in a portion of documented cases, an acute phase does develop within the first 1 to 2 weeks. And when it does, the symptoms are usually nonspecific and easy to mistake for a common viral illness. Low-grade fever, fatigue, body aches, and swelling around the eyelid if the parasite entered through that route, a particular and somewhat distinctive sign, sometimes called Romagn's sign by clinicians familiar with the disease. Swollen lymph nodes and mild abdominal discomfort can also occur as the body's immune system mounts an initial response to the invading parasite circulating in the bloodstream. This acute phase, when it's even noticeable at all, typically resolves on its own within a few weeks, and for the vast majority of people, symptoms fade and seem to disappear entirely. This is precisely where the real danger of Chagas disease begins. Not in obvious illness, but in deceptive calm. The parasite doesn't vanish just because symptoms do. In many cases, it retreats into a chronic phase, settling particularly into heart muscle tissue and the tissue lining parts of the digestive tract, where it can persist for years or even decades, largely undetected, occasionally causing low-level inflammation and gradual tissue damage that produces no noticeable symptoms at all during this extended period. In a documented subset of long-term cases, this slow, silent process eventually progresses into serious chronic illness, most significantly affecting the heart. Cardiac muscle tissue can become gradually scarred and weakened over years of low-grade parasitic damage, eventually leading to an enlarged heart, irregular heart rhythms, and in advanced cases, symptoms of heart failure, shortness of breath, fatigue, and swelling in the legs, appearing in someone who may have no memory of ever being bitten by anything unusual decades earlier. Less commonly, the digestive tract can be affected in a similar slow, progressive way, leading to significant difficulty with normal digestion over time. Picture someone living in an older rural home in South Texas, the kind with small gaps around window frames and a porch that's hosted generations of nesting wildlife underneath it. They wake one summer morning with a faintly itchy welt near their eye, assume it's nothing, and go about their day, never suspecting that a kissing bug fed on them while they slept, or that anything beyond a minor bug bite occurred at all. Years, sometimes decades, pass without a single related symptom, until a routine medical visit eventually uncovers an unexplained irregular heart rhythm that ultimately gets traced back to a parasite that's been quietly present the entire time. Diagnosis typically requires blood testing to detect the parasite or the antibodies the immune system produced in response to it, since the disease often gives no obvious external sign once the acute phase passes. Antiparasitic medications can be effective at clearing the infection, particularly when caught early, but treatment becomes more complicated in the chronic phase, where the focus often shifts to managing cardiac symptoms directly, rather than eliminating an infection that may have already caused lasting structural changes. Anyone in regions where kissing bugs are present who notices unusual symptoms after a nighttime bite, or unexplained cardiac symptoms with no clear cause, should seek testing specifically for Chagas disease. There's one more detail about this insect that explains exactly why its threat has remained so persistently underestimated in the United States, even decades after doctors first confirmed it was here at all. Here's the detail few people realize. Chagas disease isn't some distant tropical threat confined to Latin America. It's already established in the wild insect and animal populations of the southern United States, and documented locally acquired human cases, meaning infections that occurred without any travel outside the country, have been confirmed in multiple states. Despite this, awareness remains extremely low. Partly because most acute infections produce no recognizable symptoms at all, and partly because the disease's slow, multi-decade progression means the connection between a long-forgotten insect bite and a cardiac diagnosis later in life is rarely made by patients or even by physicians unfamiliar with looking for it. The kissing bug doesn't need speed, venom, or aggression to be one of the most quietly consequential insects in this entire series. It needs only patience, feeding undisturbed in the dark, leaving behind a parasite capable of working in silence for years before anyone notices anything happened at all. And somewhere beyond it, another creature is waiting, one whose danger reveals itself not through stealth, but through something far more immediate.